Opioid addiction is a national public health crisis that affects individuals and families regardless of their age, race, or income. The statistics are overwhelming. More than 130 people die from opioid addiction every day. But there is hope. Recovery is possible. This podcast is for informational purposes only and should not replace advice from a medical provider when making healthcare decisions. This podcast contains opinionated content and may not reflect the opinions of any organizations this podcast is affiliated with. We will discuss opioid use, opioid treatment, and physical and psychological trauma, which may be triggering for some listeners. Listener discretion is advised. Today on Someone You Know, we're speaking with Jenny Wagner, a health reporter in the greater Philadelphia area who has spent years covering the opioid epidemic. In this episode, Jenny discusses her personal approach to reporting, how she has seen the media coverage of the crisis evolve over time, and her advice for maintaining respect and sensitivity. I'm your host, Heather Major, and this is Someone You Know. Jenny, thanks so much for being here today. We're very excited to have you on this episode of our podcast because we haven't had the perspective of journalists. We're going to talk a little bit about messaging and how it relates to stigma and the opioid coverage that's going on pretty fast and furious these days. But before we do that, if you wouldn't mind introducing yourself.
My name is Jenny Wagner. I'm a health reporter for the Bucks County Courier Times and the Intelligencer newspapers, and including the Burlington County Times in New Jersey. We're all in the Philadelphia region, outside the Philadelphia region.
Great. So let's talk about your report for the Bucks County Courier Times and your experience covering the opioid epidemic over the last few years. Anything particular stand out for you as a reporter?
Well, certainly the speed at which that this has kind of emerged. I began my career in Western Pennsylvania as a general assignment reporter in 2010 and was working scanner shifts at night, and that means basically just listening to the scanner, waiting for sirens and things like that, and just covering whatever pops up. And I kept noticing more and more calls for heroin overdoses or people who were unresponsive, and mentioned something to a couple of reporters, and didn't seem like anybody really kind of knew what was happening, and decided to ask some questions. Reached out to one of our local treatment centers at that time, the medical director, who mentioned the word epidemic, and that was 2012, and that was the first time I had heard anything about what was going on. It seemed like first responders and medical personnel and folks who were really on the ground knew about this, but it really hadn't reached kind of our level and the level of the general public at that point. I know a similar timeline happened here from my colleagues who were covering the emergence of the epidemic on the ground here in the eastern part of the state. And I think just in that short amount of time, we've gone from, I think the numbers in Western Pennsylvania were in the 20s, in my counties were in the 20s in terms of fatal overdoses, and now we're looking at hundreds and thousands, in counties and across the state. So that's shocking and terrifying.
What drew you to reporting in the healthcare space?
Most definitely the opioid coverage that I was doing. My editor, and he joined our newspapers out west about the same time that I was starting to do this coverage, and really he had more of a focus on topical beats, and so quickly kind of moved me into reporting on the opioid crisis and kind of healthcare in general. I kind of have to pick up regular health news as it happens, but when we're focusing on enterprise reporting, which is what I do as part of a team of reporters, we kind of hone in on a specific topic. So like last year, during all of 2018, we wrote stories about the opioid epidemic, dedicated pretty much all of our time to that.
Let's talk a little more broadly about what you're hoping that your work and your coverage achieves through the opioid epidemic.
I think in the beginning it was the awareness. It was bringing to light the issue. Like I said, we really weren't aware of what was going on in the beginning, and I don't think the public understood it either. I had a lot of surprise. I heard a lot of surprise from readers and from people after the initial series that I did, and that was 2013. And I think everyone kind of knows generally what's happening now. I mean, it's hard to not know how these communities are being affected and how neighbors and your own families are being affected. So now I think my focus and my hope has been on, what's happening, what's being done to, to make a difference. How are we going to change this? How are we going to save lives? How are we going to help people? And what are the barriers to that? Where are the gaps that people are falling into? And I think that's hard. Like, it's hard to have those answers when you have something that's emerging and so quickly, like I mentioned. But we've really been trying to push the discussion to those new places.
I think your work speaks for itself. I think you've done an exceptional job, not only covering policy, but programs, but also people. Do you feel like this has changed you personally?
I've been asked a few times, by people in the recovery community or people who are struggling with addiction, if I'm in recovery or I have an addiction, or if my family members do. And my family has been touched by addiction, not by any means some of the very tragic and significant ways that some other families I've talked with. But it really, I try to be as empathetic, and I try to walk in people's shoes as much as I can. That's been one of the ways that I've been able to bring those stories to light in a way that I think is fair and respectful and really honors their journey and their struggle.
Jenny, you've brought us to sort of the next part of what I think our listeners want to hear, and certainly we've been exploring about messaging and the stigma and the way that the media industry as a whole approaches opioid-related stories. Can you share with us a little bit about your perspective on what the media's role should be?
I think in terms of what it should be is definitely the traditional role of the media, to shine a light on the issue. So I've seen a lot of other outlets follow kind of the same trajectory in their coverage as we have, but definitely highlighting those places where there are barriers to people getting help or getting treatment, or there is corruption or people taking advantage, because that's another kind of issue that we have seen and that we've really tried to focus on is people being taken advantage of, because they're in such vulnerable positions often when they're in their active addiction, early recovery. So many points at which they can be taken advantage of, or they can just not get to the place they need to go, or maybe fall through the cracks, or what have you. And so we've really tried to get into those places and to find out where things need to be changed or where things need to be moved to help fill those in. I think that's definitely a goal or a responsibility of pushing those conversations and asking the hard questions and asking for people to take action.
I think it's important that we recognize that the media has many roles when it comes to communicating information, but to your point, galvanizing a community or galvanizing people around an issue is certainly one of them. Do you feel like, given the sensationalism of this epidemic, do you feel like there's also media outlets that start to create divides, or focus more on the divisions between thoughts and people and the subject?
I wouldn't say, I wouldn't necessarily know specific cases or specific outlets or things like that, but I'm sure it does happen. I know that there are even stories still that kind of focus on maybe the effects or the kind of consequences or the negative impacts on society as a result of the epidemic, or as a result of addiction and drug use, as opposed to, okay, what's on the front end of that? What's the cause? Like, maybe we're over-reporting on crime, or we're over-reporting on someone's addiction and the things that they're doing as a result of their addiction. Maybe the criminality that results in that.
But having that awareness, you think, is really important as a reporter.
Yeah. To give an example of, where that comes into play, there was a story I was working on, this was a couple of years ago now, and it was some kind of new treatment method that we were we were talking with a doctor about, and he had a patient who we were going to speak with, who was hopefully having success with this new treatment method. And literally the night before the interview and before we were supposed to go and take photos and stuff like that, he had a relapse and had, I guess, reportedly broken into some houses and stolen some things and things like that. I mean, incidents like that maybe for some outlets would be an opportunity to report on a crime, whereas, that was something. Now obviously we didn't go forward with his interview for this treatment method, but one of the things that has come into my perspective with reporting on this is that relapse is part of the disease of addiction, but also at the same time, like, we don't hide if someone has had a criminal past or history. We try to balance that.
Right, but not painting the total picture being, these are bad people. Exactly.
It's not the whole person. It really isn't. That's why I think, getting to know these folks and getting to know their families, and, similar to your campaign, putting a face on things is so important.
You talked earlier about in the beginning, when you first started reporting on the opioid crisis, there was low or no awareness to now. What do you think the public perception is now?
I definitely think that even beyond just from the media coverage, just knowing people in your community, in your life, knowing people who you would say, well, I never thought that person could have, I think that's opened many people's eyes to this and who it can affect and how it can affect us.
You're a reporter, and so language is obviously really important to the work that you do. But what's your take on language and how important it is to be a part of the change that's happening with the way we speak about addiction and people who are experiencing addiction?
So that was actually something very early on that I tried to be conscious of. I worked with the medical director that I mentioned earlier from the treatment center out in Western PA, was very clear about how language and the words we used in our coverage could affect people and affect the stigma. And his name was Dr. Neil Capretto, and he passed away since then. But I really worked closely with him, and he was very insightful about that. And so I kind of had an early shift in my use of terms. In, I think it was 2017, AP style changed, and that was huge for the journalism industry. An entire, revision of addiction and how we treat that. And as a healthcare reporter in general, I use person first language, so describing the person first, as opposed to using a disease or a condition to describe them. A person with diabetes as opposed to a diabetic, and that's not always the case for every condition. I actually had retweeted a thread a couple weeks ago from Healthcare Journalists Association, one of their staff members, who was talking about how she usually defers to the person, and that's been my kind of strategy with opioid reporting. Is if I'm quoting somebody and they're calling themselves maybe an addict or a junkie, or they're using that language. Sometimes I will use that language in their quote in terms of honoring how they identify themselves, and that's kind of sometimes that outweighs the style guide, if you will, and that's kind of what this healthcare journalist reporter was explaining in this thread. But it was just very interesting to me that you honor kind of what they would like to use for their own description, I guess.
Yeah. What kind of feedback have you gotten to that? Because I've read much of your work, and you do such a great job of making sure that you're sensitive to the language, to the person first. Have you gotten any feedback from your readers or from your the broader audience?
I have gotten comments about just from people who kind of really don't see it as a disease. They maybe still kind of have that stigmatized view or that that perspective of folks, and sometimes it's people's family members. I mean, they're maybe very sensitive and very hurt by what their family member has gone through or done to them. And that's, you understand that perspective as well. But we try to be very mindful and not, perpetuating that on our end.
You've really stepped away from that language. It's helpful to know that there's a broader agenda there with the AP style guide, which is really great. Do you want to explain a little bit about what that is for our listeners who don't know?
So the Associated Press is our major news organization, wire service in the country, and so we kind of adhere to a style that we all generally use. I think it's sometimes kind of jokingly referred to as the journalist's Bible, the AP style book, and you just kind of go to that when you're writing maybe a proper nouns or how to refer to something. It's just so we're all kind of on the same page with our style of writing. I try not to get too jargony. A lot of times with healthcare, that can be really easy to do. And I'm thankful that I kind of can understand when someone's speaking to me in healthcare speak, if you will, but my job is really to translate that. But I do try to balance it and give kind of the clinical language in some ways, saying substance use disorder and addiction. Sometimes I'll use those interchangeably in the same article so that people understand that those, are, because if they're hearing these things, from doctors or from treatment specialists or whatever, they also need, I try to use that as a way to educate them about what terms they might hear and what those mean, kind of in a backward way, I guess. I'm not really saying this is spelling out the definition per se, but just using them interchangeably so that people are familiar with the terms rather.
Language, in terms of stigmatization is one thing, but then language just to understand substance use disorder, that seems it's very wordy. What does that mean? But being able to interchange that with addiction, I think, does level set for people a little bit in a different way. And it goes back to what you said earlier about things being relatable. So for people to really understand something, whether it's a person sharing their story or the way that you report, it has to be relatable.
Well, and also kind of elevates it to, where we're on par with other diseases. We hear these clinical terms for other conditions and other things in the healthcare arena, and I think that addiction is on the same. You're using the same language in discussions of addiction is important. Very important.
So, what is your perspective on the future of media coverage and the opioid epidemic?
So I think definitely the accountability. I think where we're also looking now is how is this continuing to evolve? You have other substances and other drugs that are kind of emerging at the same time. You have all these very potent opioids, fentanyl, carfentanil, all of these kind of new emerging threats that are making the situation worse in some ways. There's a lot of success. I think we're starting to report on some of the success stories or some of the promising treatment methods, or those kind of. I don't want to say we're on the other side of this epidemic, right. And we've asked that question: are we turning a corner when we've seen the numbers that the opioid overdoses are declining or the heroin overdoses are declining? But then there's always kind of something on the other side of that where it's like, percentage of deaths attributed to fentanyl are still increasing. So not losing sight of that, not letting those things go unnoticed is important, I think, going forward.
I think it's a great perspective to bring to our listeners too about when you read something, understand that there's more to it than perhaps that particular article or a particular sentence within an article that refers to data. Now that you've been in this space for a while, are you starting to see other hot button issues come up that are related to this, that are not related to this?
Definitely some of the other drugs. Methamphetamines are a real emerging concern. But I think one of the other things is that this opioid epidemic and overdoses in general has been changing our demographics. It's been changing our family structures. You have, grand families, quote unquote. We've reported a lot on that. I mean, parents who have been struggling with addiction, or maybe parents who have passed away, and so grandparents are stepping in to raise their children, their grandchildren rather. We have, life expectancies that have been impacted by overdose deaths. So I think those are really big issues right now, and are going to continue to be, to see how this impacts us long term. The other thing I think is maybe the abuse or the corruption or the ways in which people can be taken advantage of. My colleague reported on a treatment center in our county that had been taking advantage of people, and there was some things with that I think, those kind of things, when you don't have like a regulated system or clear understanding of how something works, there can be opportunities for that. And as I mentioned, these people are often very vulnerable and in very vulnerable places in their lives. So those are all areas where we continue to look.
Again, it goes back to, the media has a role to play and to bring our attention to maybe the things we're not thinking about, the things that we hear about, but you all through the media, and certainly you as a reporter, substantiate those issues.
A couple years ago, we did a series about recovery houses, and it's a very common model in our county, and there were lots of them. There are lots of them in our county, and people were really concerned. People were really upset because these were popping up in their communities, and a lot of the initial kind of tips, if you will, or comments that we were receiving from the community were, that they didn't want these in their backyard. There was a lot of NIMBYism happening, and we covered that aspect, that people did not want people living next door who were in early recovery, or who maybe were still, in some cases, in active addiction. And that was a very challenging story to do, because these recovery houses, there was no regulation at the federal or state level to say, how they operated, any standards whatsoever beyond their self-regulation as a kind of industry group or as an affiliation. But that was something where we saw the successes and the failures of that system, where you had something that was really beneficial for people to live in a sober environment, that was really important to giving them that longer term success and helping them transition back into the community after treatment. But then these places where people, if they weren't being run properly, there was no oversight, then they could be taken advantage of. And we had cases, and my colleague reported on cases where people were dying and overdosing in homes.
The fairness of your reporting is really important, but also sort of the exploratory nature of your reporting is also really important, because there are things that are going to come up, and to only report on one side of it, it really isn't fair to being a journalist. It isn't fair to your readers and your listeners, but to also come back to those issues with additional insight, I think is really important as well, because oftentimes the first thing you hear is the one thing that sticks, but to be able to come back and report on it in a different way, in a slightly different way, I think is really important as well. And like you said, with this epidemic, the opioid epidemic, 2012, maybe a lot of people were feeling and thinking a certain way, but through their own experiences, through really great reporting, I have to imagine that people are thinking a little bit differently about the epidemic. And I know that, we're trying to break down the stigma, and it's great to know that we have, great reporters like yourself who are also trying to make sure that you're not only breaking down the stigma, but you're also addressing all the things around stigma that people may not be even thinking about. What do you think we, the collective we, could also be doing to further the conversation around stigma?
I think that people have increasingly been sharing their stories. I mean, I've noticed that, it's definitely an individual choice. I think a lot of people wanted to use an alias in the beginning when we would report on these issues, and now we do see people using their real names. We do see people coming out, and we have always kind of been very careful with that. That's the stance that myself, my colleagues, and my editors have been fortunate to kind of have those good conversations and say, this is something that down the line when this person is in long-term recovery because of the stigma, like might really hurt, their employment chances. I think you guys talked about that on the podcast. So that's something we've always been conscious of, but we've seen people like owning this a lot more and really being more open about it. One of the other things is, I think, parents and families. We've seen a lot of obituaries where they're acknowledging that someone has died of an overdose, and that's terribly tragic, but I think that's gone a long way to bringing it home.
That's something that I've learned through this process is it's great to have people coming forward, and it's great for people to share their stories, whatever their story may be. But it's also great to know that behind that is probably a broader conversation happening in the community, and that's really, really important.
Mm-hmm. I think every time we have somebody that we've talked to, we always kind of emphasize that, this is helping to get information to people, or helping to put this in perspective for others. And I hear that from a lot of, mothers or family members or people who themselves are struggling, and they say, if this could help one person, and I often do hear from people that have been helped, or that's resonated with them.
It's an incredibly selfless gesture for someone who's gone through pain and suffering and maybe succeeded in recovery, maybe not, to be able to come forward and say, listen, it's still really painful, but if it helps another person, that's what I want to do. Do you think there's going to be a change in the way that media covers not just this epidemic, but other epidemics that have this level of sensitivity going forward? Do you think we've learned anything in the context of how to better report on these types of issues?
I definitely think like the language is an example that we have learned something, that we're taking a broader look at this issue and not just focusing on this one aspect of a person, and it's what's driving that, like what are all the different factors that go into why someone develops an addiction. What's what are some of the clinical reasons? Like we're taking a very holistic look, I think, in a lot of ways, and looking at it very differently long term as well. That this is something that people are going to continue to struggle with. Like we might end up reporting on years from now, kind of the implications of a lot of this, on society. I mean, I already mentioned like the demographic shifts. So I think to have that broader perspective is going to change what we cover in the future and how we cover it.
And if you wanted to give advice, would there be any advice that you would give to your peers in the media?
Just definitely to kind of get in there and get to know people. The recovery community is amazing. Like it really is a community, and I think that's a really important thing to the recovery community and to this community, is that you understand or at least you see what they're going through. Right. And so I think that that's invaluable, is to and you need to earn the trust to kind of get into that community. You need to listen, and I mean that's what we do as reporters generally, is listen. But I think just giving that time and not just trying to parachute in and report on the issue, but really getting in there. I would also encourage readers and the public, not just in my coverage area, but whoever your community newspaper or media outlet is, reach out to them if you see something, like if you see a gap that people are falling into, or you see people that are being taken advantage of in some way, or we really, especially with newsrooms getting smaller and smaller, we really rely on the public to help us do our jobs.
There's certainly no greater issue in today's society than the opioid epidemic, and we're so fortunate to have your perspective, Jenny, and all the great work that you and your colleagues do every day to make sure that we're not only staying informed and aware, but that that we have sensitivity and that we have an opportunity to better understand people and how this disease affects not just the person, but the family and the community. And then just want to thank you. Thank you for your time today, and thank you for the great work that you continue to do.
Thank you. Thank you so much for having me.
Of course. If you or someone you know is suffering from opioid addiction, please visit ibxfoundation.org/SYK. The link is in our show notes below.